Joining us in the studio this morning is Tony Johnson. He is with Solvera Health, our Director of Marketing. Good morning.
Good morning. And over 90 next week. I'm sweating already.
I know.
From that. It feels like I haven't even transitioned my closet yet from the winter clothes to the summer clothes. I think that's my Memorial Day work there.
I hope you can get some fun in, though, too.
Well, I am. I became a grandfather 3 months ago, and my daughter and my son-in-law and my baby are here for 2 weeks. So my Memorial Day is going to be sitting in my rocking chair with a 2.5-month-old, and there's no place I'd rather be.
Yes, so. Fantastic. Well, what's the name?
Liam,
so a little boy.
Yeah, a little boy, and taking him to his first baseball game. We rented a suite at the Peoria Chiefs on Saturday night, so we figure that's safe. It's cool, no foul balls in the suite,
right.
So it's safe. We're having a little mini family reunion. So yeah, I made that transition. I think since I talked to you last time, I made that transition from, I've been a father and a coach and a football player, and I do radio and I do marketing, and now I'm a grandpa.
Good for you.
So,
it's so special, isn't it?
Yeah, everybody talks about how really cool it is, but you can't define it. And it's like your life is this way, and then in 1 second, it's totally different.
Yeah. Your legacy.
Your legacy, and it's the happiness that you see for your kids.
Yes.
And that the journey that they're about to go on is one that you've been on.
Yeah.
And that's the cool part of it.
Well said, Tony. Very happy for you and your family and little baby Liam. You have to send us a pic.
Oh, just follow me on Facebook. You get plenty of those.
Okay, so, can do. That's the good thing about social media.
It is,
pictures.
That people say, oh, you post your kids all the time in sports. Well, dang right. That's what I want to see, right? I don't want to see your political stuff and all that. It's just, I want to see your family. If your kid hits a home run, you better post a video of it.
Right.
I want to see that. So I like it for that.
Yeah, the good stuff. That's the good stuff. That's positive. Right. Yeah. How are things at Solvera?
Doing good, man. It's hard to believe that we're already talking, 90 degrees, and I think we're making plans for July 4th, and I don't know where the year has gone, but it's been we've grown from one location and 0 patients to 3 locations with 6,000 patients since July of last year, really. So, well, I guess early last year, but it's been just a growth pattern in it. It's a testament to the need of healthcare, not so much about how great Solvera is. We like our model, and our model is different. But there's a really big gap in healthcare, and in particular for primary care. And kind of having that doctor that's your quarterback. Our society's kind of gotten away where you get dependent on your specialty doctors, but nobody's quarterbacking your health care. And that's the model that people are really liking. We work well in the ecosystem. I stopped at our Galesburg clinic on the way over here, and we just put up some new signs. We have Springfield Clinic and Carl Health are renting specialty offices in our clinic. And unlike the big healthcare systems where they want you to all work with just their providers, we're going to do primary care, but we want to help connect you to those specialty doctors and to your hospitalization. And then people are liking that.
That's a very good story. 3 years or 3 locations, 6,000 patients in 1 year, but that boutique style of healthcare.
Yeah, we talk about comprehensive primary care, and people, what is comprehensive? Well, we define it in kind of 3 buckets. One, it's care. So we have Solvera Care, we have Solvera Well, and we have Solvera Sure. Care is your immediate need. You need care for something, and in particular, primary care. My son is 26. You mentioned primary care to him. He has no idea what that means. When he's sick, he goes on his phone, he searches doctor, and he goes to an ergo. Well, he has an ear infection today and has a sinus infection 6 months from now. He goes and sees somebody different. The insurance companies and kind of the market is wanting people to go back to their primary care to quarterback it. We had a lady come into our clinic in Peoria the other day, and she had a small carry-on bag like airline, was just full of her medications. No primary doctor, but she had a number of specialty doctors. And so finding somebody to do that. So we want to really take care of that care side of it, not only the primary care, but we offer, comprehensive pharmacy, x-ray, physical therapy, kind of take care of as much as we can. Not really, somewhat an urgent care. We have a procedure room. We do IVs pretty regular, so you don't have to go to the hospital. And then I talked about this referral. We see ourselves as kind of the Switzerland of healthcare. All healthcare is important in every community, and whether it's OSF or McDonough County or Carl Health or Springfield Clinic or whoever, we work with all of them because we believe that the community is better when your healthcare ecosystem works. So that's our care side of the business.
Okay. A lot of events, too, that you're going to be supporting here locally in Monmouth and Galesburg.
Yeah, I like the summer. I got this big 10-foot tent that I get to haul around and put up and tear down. And gosh, we've been at golf outings already, but we're going to be over here in Monmouth next Friday for the Banking for a Cure. Look forward to that. We haven't done a golf outing here. We really like the golf outings because we set up on a hole. We give away some stuff, but it's more of an opportunity for us. Every 10 minutes, 4 people come through, and we get to talk a couple of minutes about, not only who Solvera is, but we get feedback on what we should do in the community and the support from healthcare. So we like that. We got the Galesburg Chamber of Commerce. We're a major sponsor for that. We've got things like the Balloon Fest in Galesburg will be there. We are going to play a major role in the July 4th fireworks at Galesburg at Lake Story this year, so there'll be more to come on that. We're at a health fair today. Yeah. There's a senior health fair at the Knights of Columbus in Galesburg today. I think there's 45 vendors. So if you're a senior and you want to get out and go to the Knights of Columbus in Galesburg today, there's a really good health kind of senior fair there, where you can go talk to a lot of the companies that support seniors. So, yeah, it's summer is very busy for us. We'll be over here, of course, for Prime Beef Festival again. So we like doing that stuff. Yeah,
and you're also a sponsor of Halfway to Freezing for Food that we have coming up on June 7th, 8th, and 9th. So I'll get with you on what that's going to look like.
Yeah, we like that. Another sponsorship that we did, and it's really kind of cool. It's called Golden Tours, and it's a tour bus group that they primarily work with seniors. They're based out of Peoria, but we partnered with them because they leave in the morning. It's usually day trips, and we have these perfect locations in Peoria and Gales. We have these clinics with big parking lots. So we've started that. They've got 1 or 2 trips a week, and she just started any of her trips that are coming west. They stop in Galesburg. Mm-hmm. So they went to Amana Colonies last week.
Sure.
So they left Peoria, they stopped in Galesburg, and they've got 6 or 8 tours that are pure Galesburg departures. And that's good. It gets people in to see our clinic, but also I want to go on one of those trips. I mean, they go all day. Everything's taken care of. And again, just trying to be involved in some things different with the community.
We're talking with Tony Johnson, Director of Marketing with Solvera Health, bringing hospitality to healthcare. What does that moniker mean?
I get asked that a lot. As a marketing person, you have your tagline. What is it that drives it home? And the quick history is that our owners come from a restaurant background, and Phil has been on here with us a couple of times. And that hospitality that in the restaurant or the hotel business. I've learned as I've transitioned from Caterpillar, 34 years there, into healthcare as marketing. The number one thing is just answer the phone, return calls, and do what you're going to say. That's a rarity in healthcare these days. Try to call and actually get somebody. So we want to do it when you come into one of our clinics. There's no glass. There's no, that grumpy person sitting behind a window or give me your insurance card. It's a friendly, open. You'll see it when you come into our clinics. You just feel this vibe of friendliness. And so the hospitality comes taking that same mentality of the hospitality industry and bringing it back to healthcare. Not that it was never there. It's just it's kind of gotten lost. And that means, doing what you're saying, answer the phone, helping people. Don't just say, you need to go see a cardiologist. You're on your own. We say, you need to go see a cardiologist. We have these 3 options. We'll make the call. Why don't you in Galesburg? Why don't you walk across the hallway? You can go see the cardiologist at Springfield Clinic. Right? We do all that legwork for people. And especially as we focus on the senior and the Medicare population, that's something that's really important.
Yes. And that same hospitality concept is lost in many industries, and certainly not just healthcare. It's nice to have hospitable people to work with. So I hope it spreads. We can spread that mentality to all kinds of businesses again.
Yeah, it does. I mean, we look at every morning I get up and we send a survey. So if you come and see us yesterday, you'll get a survey from me, email and text saying, hey, it's 5 questions. what was your overall rating, 1 to 10? How did we do for you? And anybody that gives us a survey score that's less than 7, we call them. Hey, well, we got your survey score. We'd like to talk to you about it. What can we do to improve,
Sure.
right? And it's that type of thing. And actually, I kind of look forward to it. We call anything that's below a 7, oh, we got a stinker today. So, we got to go follow up on this. But it's that personal side of it. And to me, 90% of our new patients are referrals from family and friends. And so if you keep the existing patient base happy and satisfied, they're going to spread it on. We just, our online reviews, we just got to 150, which is pretty significant. And we're up to 4.7, approaching 4.8 stars. In healthcare, you get above, 3.5, you're doing well. And so our patients are happy, and we believe that that's the key to it. We can't solve all their problems. Some people have some hard problems. And so, but we know we have the network and the ecosystem to bring in the right people to help them.
Okay, fantastic. Thanks for keeping us updated as you build this family network of healthcare throughout Carbondale, Peoria, Galesburg, Monmouth area here. So it's really good success. Glad to hear about it.
Yeah, Galesburg, we're excited about that. Dr. Santiago is still accepting new patients. He's one of the, everybody loves him. I mean, we were in the parade here last year for the Prime Beef Festival, and he knew it was Santiago, hey, doc, the whole way down the street. And he's just one of those that if you don't have a primary care doctor, come and see him. You're going to like him. And if you have one that you like, great, stay with them. But if you have friends or family that are seeking one, go see Dr. Julio Santiago in Galesburg. You won't be disappointed.
Okay. Tony, thanks for coming in this morning.
You're welcome. Thanks for having me.
And congratulations again on little Liam being a grandpa.
Yeah, I got this white hat that says Grandpa on it. So, I actually wear a Grandpa hat now. I never thought that day would come, but it's here.
Well, many more to come, I hope.
Yeah, thanks.
Tony Johnson with us. He is the marketing director with Solvera Health on 1330 WRAM and FM 94.1.